Alright, so I'm going to have you go ahead and lay or stand up for me. And where is there? Okay, so I'm going to go ahead with my first adjustment, which is a prone index blood pressure. So I'm going to go face down for me. Okay. And then lift your legs slightly. Set to neutral for that. Okay. And so basically I have a right rotation restriction. Stuck left, and I'm going to be ipsilateral. So, and basically, we have to verbalize line of drive, verbalize appropriate tissue pull. Verbalize force. Okay. And we're at C3. So I'm going to feel just under the occiput, drop off. First TVP will be C2. Drop down from there. There's C3. Appropriate tissue pull. So my first tissue pull is going to be medial to lateral with my superior hand, or P to A, medial to lateral. And I'm going to have you rotate your head to the right for me. I'm going to follow that. Then I'm going to basically stabilize with my contact hand on the mastoid, my hypothenar. I want my arm 90 degrees to the floor, and I'm going to, my line of drive is P to A, basically lateral to medial, or in this case left to right for the patient. And so basically my force generator for that is going to be pec tricep there coming across. And how do I bring the segment to pretension? So basically by bringing the segment to pretension, I would have come and did a inferior to superior distraction on the mastoid up, and then I brought the station, and as I rotate him around, that brings it to tension, and then the drive through. And then for my second one, I'm gonna have you go face up, if you would. So basically, okay. So for this one, basically I'm gonna roll. I'm gonna put my here. Could you lift your head real quick? Put my hands under the patient's head. I'm gonna relax. Slightly roll the patient's head to the right. I'm going to take my contact on the supramastoid ridge with my hypothenar. So I'm basically there with that. And then pre-tension, I'm coming basically for my tissue pull, I'm coming superior to inferior, getting a good grasp on that. I'm going to rotate them back, laterally flex and rotate to isolate that condyle. And then for pre-tension, I'm driving the hand here and just maintaining, driving the hand, and then I'm going to do a pec tricep thrust through to drive that, and that would be basically a P to A, S to I, left, or it would be lateral to medial, in this case, right to left. So you stay there for me. Appropriate. So patient give, verbalize the appropriate tissue. Yes, yes on both. Segment to pretension. Yes. Verbalize the appropriate line of drive.
You have 30 seconds remaining.
Verbalize how the force is applied and generate. Off of that, it was also so off of the last adjustment, the hypothenar occiput push. That was a pec tricep as well.
Good.